Greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk this morning just a little bit about Class 2 correction. And we had springs that you could put on somebody. This was several years ago, and this little girl was just the nicest patient in the world, but she just would not wear elastics to correct the Class 2 problem that we had, and so I used springs on it, and it was so efficient, and in just about 2 or 3 months we had the Class 2 problem completely solved using these springs. So I'm going to show you how to use them in case you are interested in doing that. Let's get on with it. Deal. Let me touch this. She's a real sweet little girl, but she just flat would not wear the rubber band. She was scared some way or another they didn't do. So we connected the springs up in a normal face. I'm just going to run through and show you how to do the springs. Now, of course, we had several other little problems. We had a deep bite, you see, and this is tucked in. It's kind of a Class 2 division. And you're going to have to raise these teeth up here and open the bite up and do several other things which we've covered many times, so I won't take time out with that. But you see it's Class 2, and we're going to have to change these teeth and raise them, and the lower jaw come forward on here, and we'll have to do that with springs. And this can be done. And we were working with the back teeth banded up and everything, and we had removed some teeth in her case. She had a very crowded case, so we taken out the bicuspids in here. Now this was back in it was way back there. Anyway, back then we extracted a little more than we do now. So we had leveled this out. And now we put these heavy springs and you tie them onto the deal. And in other words, they don't take them out. They brush their teeth with them, they keep them in the mouth. And in about 2 months, we had the Class 2 corrected, and I had worked for several months and had made no progress at all because the girl wasn't cooperating with us. So we put these springs on. And if somebody may be interested in doing that nowadays, you just put something that is a constant thing, and you'll get results really quick. And this is what happened. So we pull this back with this type of spring. It was a double spring in here, and you could hook it up. The person could open their mouth all the way, and the spring would give. It wasn't as strong as it looked, but it was large enough where they didn't bite it and flatten it out. And so it put that on, and then I think it was 2 to 3 months, 2.5 months, we had the Class 2 problem corrected, and we had worked for a long time prior to that doing it. I don't show the finish of the case, but it worked out fine. And so this is springs used in orthodontics, if you want to look at it. And we made a little deal here to connect the spring out further. And let me get that, and I'll show you that part also. Anyway, we made a wire that would hook up here, and that would be flexible. Now this is a mirror shot from the side. This is not 2 springs. It's just, this is a mirror picture of this spring right here, right there. And the girl could open that thing, but this is a constant thing, showing you that something that's continuous, working there all the time. It can be gentle, not real strong, and it'll straighten the teeth up in a portion of the time it takes. you go off and on with them. So that's one good thing I learned about that, how quick you could correct a Class 2 problem. Now we've got other things for doing Class 2, but this is a excellent way if somebody's still interested in doing that. So thanks again for watching, and I hope we have given you some ideas about Class 2, and if you need to, you can go back and do those things. Thanks again now, and I hope you'll join our deal and sign up. Thank you.